Hello everyone and welcome to Rad Chat, founded by me, Jo McNamara.
And me, I'm Julka-Anderson. RadChat is a forward-thinking global knowledge hub where healthcare professionals can advance their expertise in therapeutic radiography and oncology. Unlike traditional academic resources, we blend real-world experience, expert insights, best practice and patient perspectives.
We make advanced knowledge engaging and accessible, supporting continuous learning and professional development without compromising patient care or your personal time, by providing insights into both technical skills and career development, helping you to progress confidently in your field and shape your professional future.
Just to let you know, our episodes may contain sensitive and difficult topics that you might find distressing or triggering. Please consider checking out another episode.
This is episode 201, which is part of the Education and Workforce Development series, where we're going to be hearing not from one, not from two, but from three amazing guests, Hayley Gibson, Hayley Snowden and Jo Ormesher, who will be talking about how they're tackling health inequalities in their region. So welcome all to Rad Chat. It's good to have all three of you join us today.
It's good to be here. Thank you for having us.
Perfect. So let's do introductions one by one. So Hayley, would you be so kind as to introduce yourself, please?
Yep, so my name is Hayley Snowden and I'm a Health Inequalities Programme Manager for the West Yorkshire and Harrogate Cancer Alliance.
And Hayley G.
Hi, thank you for inviting me to the podcast. This is exciting. So I am Hayley Gibson and I am the Lead Radiographer Leeds Teaching Hospital for breast imaging.
And Sue.
Sue Ormesher, and I'm the Communications and Engagement Officer for the West Yorkshire and Harrogate Cancer Alliance.
So Sue, how did you get to be in your role? What's your kind of career background?
It's quite long. I started out as a journalist 30 years ago, and then after about 10 years doing that, I went into communications, so kind of over to the other side really, working for a range of, over the years I've worked for a range of different public, private and third sector organisations, but latterly largely the NHS. So it's all about, getting messaging out there and raising the profile of the Cancer Alliance and increasing awareness about cancer symptoms, the importance of screening, that sort of thing.
Thank you for sharing. Hayley Gibson, would you be so kind as to tell us a little bit of background about your career and how you got into radiography?
Gosh, so I've been a radiographer for 21 years this year, and I started in Leeds University and did my student training in Leeds Teaching Hospital Trust, and then stayed and worked clinically as a radiographer before I branched into management, and I still do bits of clinical now to keep my hand in. I joined the breast team 12 months ago and became the lead radiographer over all the breast services in Leeds, and prior to that I had done other lead radiographer roles and a role specifically around quality. I come into breast with an interest in health inequalities, having launched a self-request chest campaign and kind of learned a lot about the backgrounds there. So yeah, it's something that I'm generally interested and passionate about.
Lastly, Hayley Snowden, what's kind of your career background? What's led you to kind of the role that you're currently doing now at the Cancer Alliance?
Yeah, so my background is predominantly in operations and service management, a mixture of trust work and in the community. So I was responsible for the One New Leeds programme, which is a community programme which helps support patients lose weight, be more active, reduce their alcohol intake, etc. That really early prevention for health and cancer. And about just over 4 years ago, sort of mid-pandemic, I took the role at the Cancer Alliance and moved into this particular role for health inequalities nearly 3 years ago now. So I've not got a background in cancer. It was all new to me a number of years ago, so it was a steep learning curve, but I've never looked back.
Talking about health inequalities, Hayley S., what are some of the health inequalities that people in your region face?
Predominantly deprivation. I would say that's the biggest health inequality. We know that patients who live in more deprived areas, have poorer health outcomes. We also have very varied demographics of patients in terms of those that come from ethnic minority backgrounds. Again, generally have poorer health outcomes, whether that be because of access or they're not sure what signs and symptoms to recognise and hesitate coming forward to speak to their GP or other healthcare professionals. I would definitely say they're two of the most common. There are lots of others, severe mental illness, learning disabilities, right across the board really, and that's where these programmes are so important to help support those patients to feel empowered to come forward and get checked.
Hayley, from your clinical perspective, what do you see in your role that can kind of align to health inequalities and how that impacts on people's ability to go for screening?
I think probably the most obvious is when you look at the data. So you've got to be able to, so for breast screening, we cover Leeds and Wakefield, and drilling down to the data and understanding who is coming for their breast screening or who is not coming for their breast screening, it becomes quite a stark difference between areas around Leeds and Wakefield and our inner city areas, which we class as socially deprived, have got a much lower uptake compared to the more affluent areas. And then if you can drill down further into your stats and understand who this population is that aren't coming and why, we can then start thinking about what can we do to break down that barrier.
How easy is it, Hayley, to actually access the statistics? Because I'm just thinking from my own clinical background, sometimes access to that data isn't as easy as you would like it to be. What do you do in your kind of service to ensure that you can readily access that? Or is it because of your work with Cancer Alliance that you kind of have that capability and time to kind of process that data?
It's not easy, and that was one of the steep learning curves I had coming into the service when I'm saying, where's the data? The data is a lot of us manually drilling down to understand postcodes, link then to the IMD number, to understand then what ethnicity our patients are that are using the service. It would be a lot easier for us if we could have that readily available, but I appreciate why we can't, and actually you have a sense of satisfaction if you can do some of that yourself, which me and my colleague have spent a lot of time doing in some of the areas that we have been running pilots on, to try and understand who is our population that we're screening.
It's quite a big thing to be getting involved in, isn't it? If you think about it with health inequalities, it changes per region and things like that. How have you found engaging with kind of the service users or patients, if they even understand and know what region or area they live in and how it impacts their health?
Again, this has been something that we have learnt a lot along our journey. What I think we firstly thought was we were going to go out and engage with the population. What we've learnt as we've gone on is actually it is better for us wanting to increase our screening uptake is sometimes engage with key stakeholders in the community or linked to GP surgeries. We then provide the education or will go into an area that they suggest, but we normally try to be invited in rather than impose ourselves, and we have found that having that balance and working with people a much better result, and we've substantially increased screening uptake in areas around Leeds by modelling that, and that is now going to become the unit's preferred way of working. But yes, it's often engaging with the right people rather than thinking we have got the answers.
So we've talked a little bit about kind of the socioeconomic cohorts of patients that potentially may not be accessing screening. But why is it, when you've engaged with patients and service users, why is it specifically that demographic? Is it because they have lack of knowledge around a screening or lack of education, or is it because of things like cost? Public transport is not cheap here in the UK, and so that could be a factor. But have you actually been able to understand what it is that's kind of limiting the uptake?
So it's not one thing. It's a complex reason of why people don't engage, and that could be low health literacy and understanding. It could be the locations that we have our screening centres that don't then make it easy for people to travel. As you said, it's expensive to travel, and if your choice is you're going to work or you have a family or you have caring responsibility, that is often put before people's health if they don't understand why it's so important to detect breast cancer early. Lots of our population don't engage in healthcare, they don't understand what it is, but also how we communicate can affect then people's understanding. So if we haven't got it in their language and we are sending a letter out in English and their first language, and that's not their first language, as a screening unit, how are we expecting people that may not have any understanding of what this programme is to then come? So I don't think it's one reason. It's complex. There's lots of people doing research on this now. I think our role in the clinical is to educate people, but educate the right people so that they are educating then the population.
Hayley Snowden, since coming into oncology, obviously you said you've kind of learned and understood a bit more. Is there anything that's really surprised you within the health inequality space?
I think linking with what Hayley was saying earlier about data and the significant lack of it around health inequalities, health inequalities have always been there, I think, but with the relatively recent launch of the Core 20+5 programme, which is the national programme to target those 20% most deprived populations, I think there's still quite a lack of data to point us in the right direction. I think we know what the health inequalities are. As you've just asked, Jo, why, I think, is the really key point to that, and the data helps us understand some of those barriers and the why that Hayley was just saying, but there's still lots more to look at and to share so that we can create those interventions and engage the patients to make sure they attend. It's getting better, but yeah, I think the lack of data and information was probably the biggest surprise to me coming into this field.
So, Hayley Snowden, in terms of kind of the project and the work that's ongoing, what is it that the region's doing and how can people get involved and support that?
So the main campaign we have running at the minute is called You Can Ask, and this is a Leeds predominant campaign, although it is with the Leeds and Wakefield breast screening service. It came about off the back of a piece of work that public health teams in Leeds carried out, looking at some of the barriers in 3 areas of health inequalities across the city: the learning disabilities, ethnic minority groups and patients with a severe mental illness. And those patients, as part of that insight report, said, I'm happy to go, but I wasn't aware that I could have a longer appointment or I could take somebody with me, and basically about the reasonable adjustments that the breast screening team could offer to support those patients to attend. So we're targeting patients that are willing to go, so they have that good knowledge of health literacy and the importance of a screening appointment. We're just supporting them to be able to attend with the adjustments that they require. So the campaign is basically to raise awareness that you can ask for reasonable adjustments, obviously within reason, particularly some of the mobile units. Not everything is possible, but the team are there to make it as easy as possible really for you to attend if you wish to do so. And the campaign involves predominantly social media. We've also got some information going out into invite letters from the breast screening team, and also some training and raising awareness of prompting patients and asking them if they require any reasonable adjustments, because often patients don't always feel confident or empowered to ask, and they sometimes don't turn up because they didn't think that they could ask or didn't feel it was appropriate. It's a bit multifaceted, the campaign, to raise awareness and provide patients with confidence to ask for adjustments if they need them.
There is always that worry, isn't it? Patients we don't want to put too much burden on the NHS, you're busy, that kind of thing. But actually, yes, we are, but there's so many things we can do for people. And I think that's the crossover, isn't it? That sometimes people just don't know that they can do it.
Absolutely. I think there's a bit of a power imbalance often whether it's a GP or any kind of clinical appointment, so people don't want to feel like they are putting the service out or they're being a burden or they're asking for something that they shouldn't be. When actually, if it means that they're going to attend their appointment and potentially find a cancer at an earlier stage, which could ultimately save their life in the long term, then by offering, it could be a double appointment or a letter in another language, something that we have readily available to offer, it really can make a difference.
So, Sue, what's your role been within the West Yorkshire ICB and Cancer Alliance specific to this project?
Well, as part of a communications team of two, we've worked really closely with Hayley and her colleagues, and Hayley and people in partner organisations as well, to help to develop the campaign, really. We've also had an external marketing agency who've been working very closely with us on, the best ways to reach people. One of the aspects of the campaign was to work with a group of women for each of the groups that are being targeted. Women with a serious mental illness, with a learning disability, from ethnic, predominantly South Asian ethnic minorities. So they worked with us to co-produce some of the resources and assets, which we thought was really important. So what they felt could work. We worked with the Hamara Centre, which is a centre in Leeds, and a woman who works there, who is a trusted member of that community, also lent her support to the campaign as well. So she features on some of the leaflets and the social media assets. The agency we've worked with have done a very targeted social media campaign, mainly on Facebook, sent emails out to lots and lots of community groups, so we can try and spread the word as far as possible. And from the communications team, we have been trying to raise awareness through our own social media channels, but also in the press as well. We've secured an interview with BBC Radio Leeds. Greatest Hits Radio have also featured Hayley Snowden, so that's been quite good. Oncology News Today, which is a national news website, also featured the story. And then we've been just sending out social media on a regular basis with all the key messages that we've developed with our partners, saying, did you know, you can ask, just trying to hammer that message across, that did you know, reason. And we don't tend to use reasonable adjustments because it's a little bit jargony, so we're just trying to put it in more simple language and say, did you know you can ask for a longer appointment, or you can take somebody with you, or you can go and look at the unit beforehand, just so you have an idea of what to expect. So it's that kind of thing, really. And it will be ongoing. We're hoping to create a legacy page on our website just to show what's been achieved, because the reach, particularly with Facebook, that our marketing agency have achieved has been really good, like well over a million. The last count, well over 1 million engagements, and so that's been quite impressive. So we're hoping that we can use it in the future, really, as well, and it'd be great to widen the campaign, to other areas. So, but we really want to capture what's been achieved. So that's it. Yeah, thanks.
When you say widen it to other areas, Sue, is that regions or other kind of backgrounds of people?
I think both. I mean, in an ideal world, and also we'd like to spread the word amongst cancer communications colleagues who I work with. I sit on a cancer communications network group, which is a monthly group, and we all share campaigns that we've been working on, so that if it might give people in other areas an idea, or if they're thinking of working on something similar, they don't have to reinvent the wheel. We do that quite a lot. We did it with another campaign that Hayley was led on called Remove the Doubt, which I think it was the Greater Manchester Cancer Alliance have since taken up. So it's about sharing good practice as well, and hopefully inspiring colleagues in other parts of the country to adopt similar campaigns.
So, Hayley G, obviously from Sue's perspective, there's been lots of social media engagement, but from your perspective working clinically, have you seen lots of people now engaged and ask for these reasonable adjustments as a result of the campaign?
Yes, we are. We're starting to see it coming through, and people starting to ask. The audit hasn't been complete yet, so you're a bit premature asking for the results. But we have managed to ingrain it into our admin staff, so when they're speaking on the phone, they are then used to saying, is there any reasonable adjustments, or is there anything else you need? And then all our reminder text messages now have it as part of the text, so that people know they can pick up the phone and ask. And then it's about us promoting it as well. And we've spent some time educating the radiographers about the campaign, with the support of the Cancer Alliance coming in. So they are now starting to talk about it with our ladies coming onto the screening.
What's the feedback been from the radiographers?
Really positive. They are, as clinical staff working in a breast screening unit, it's kind of ingrained into them to do whatever is needed to get ladies to have their breast screening complete. But I think they've liked bringing it all together and then thinking about it as a campaign rather than something then that, you know, we perhaps would have normally just done if anyone had rung and said, can I have this or can I need that? But it's really encouraged, it's really made us kind of like look about what we're doing. And so we've done work around our learning disability appointment invitation, and we have easy reads now readily available that can be translated into any language, and they are then specifically linked to our screening centre, so they've got our branding on them. So yeah, it's been good, very, very welcomed by our radiographers.
I always think we are absolutely missing a easy win when you look at mammography and you think every time a woman is standing there getting a mammogram, like they could literally stand there and you could have an advertising board, couldn't you, with all these amazing messages on. Exactly the same for us in radiotherapy. I always think patients are typically lying on their back looking up. I'm like, oh, you could have a nice advertising board there talking about public health messages and things like that. So yeah, maybe in the future a company needs to design a mammography machine that essentially has an advertising screen on it.
We have this in urinals, Jo. You've got all the public messaging there above it now.
There you go. You can't look away. You're standing there having your mammogram. You could do some reading. It'd probably distract the patients, to be fair, as well, wouldn't it? So. Hayley Snowden, in terms of kind of the project and taking it forward, what do you hope to have achieved maybe within the next year?
So the project finishes, I think we're in the last couple of weeks now, so we're hoping the results will show us that the proactiveness and the raising awareness of reasonable adjustments does improve the uptake of patients going, and sharing that with other cancer alliances I think would be the main goal. We do have an intranet page called NHS Futures where all cancer alliances share their project information and the assets we've created. On some of them we purposefully don't have the West Yorkshire logo on them so that they can be what we call lifted and shifted or pinched with pride, other cancer alliances call it. So yeah, it's similar to what Hayley was saying about creating best practice and for other breast screening services. And more locally as well, the Pennine breast screening service, which covers the other areas of West Yorkshire, have already been asking to say, is this something that we could perhaps do? Because if the results show that it works, we'd love to support that after the campaign. And obviously I'd love the legacy page to be accessed by lots of different people, you know, patients and professionals alike. Once that's up and running, that will remain there, that we can continue to update. So once the campaign's finished, it's about that sustainability. You know, this when ladies come for their breast screening next time they're in round in 3 years' time, they will remember the campaign, it will plant that seed, and they'll speak to their mums, daughters, sisters, nieces about reasonable adjustments, and the word will spread that way and continue to do so.
Hayley S., just as a follow-up to that, you sound very passionate about health inequalities. Why are you so passionate about health inequalities?
I think it's only right that everybody has the information to be able to make an informed decision about their health, and screening being one of them. I think if we give everybody the right platform and information to make a decision, then that's what we can do as a Cancer Alliance, really. We'd love everybody to go with all of the messaging that we're sharing, but if it's those patients that want to go but because of their health inequality can't access the services that they're wanting to. Obviously we have patients that are, I don't want to say harder to reach because our reach perhaps isn't always appropriate, they don't engage with services, those patients are trickier to remove their barriers. But if we have patients who have removable barriers, then we should be doing that for them and having interventions in place to be able to remove that health inequality. It's not that easy for everybody, but if it is, then we should have responsibility to do that.
Is there anything from kind of the perspective of anyone listening thinking, oh, I'd actually quite like to do a project as part of health inequalities within my clinical field? Is there any advice that you would give them? Because obviously I'm just talking from someone who's clinical. Sometimes, Hayley, doing the work that you do in coordinating and the strategic management of projects, sometimes we wouldn't have that knowledge and skill. Is there any top tips that you would maybe give them?
Yeah, threefold. I think the first one would be engage with your local cancer alliances. There are lots of us around the country, and there will be a cancer alliance in your area that will be open to delivering projects similar to the one we're delivering here. Secondly would be to use the data, look at the data that is available so that you are aware of which patient groups that perhaps need that additional support, so you can then approach the cancer alliances with an idea of your patient demographic who isn't attending their breast screening. And then the third one would be to co-create with patients. It's one thing creating an idea of a campaign and taking it to patients, but actually if you start with stakeholders or voluntary organisations who engage with those patient groups and asking, what do you want this campaign to look like? If you wanted to read this message or hear this message, where do you want to see it? Where do you want to read it? And that's worked for us in the past with other campaigns, and it's definitely worked for us this time again, hence why the lady from Hamara wanted to actually be in the campaign as a trusted member of the public. Messages coming from trusted community members resonate far more than it does coming from me or someone else in the Cancer Alliance. If you look like somebody on a poster in your local area and you trust them, you're more likely to listen to the messaging that they've got. So yeah, they're the three key things I would say to sort of have in mind if you're wanting to look at doing a piece of work.
Coming to you, Hayley Gibson. I was just thinking, I feel like we're on University Challenge by full naming you each time. Hayley Gibson, from your perspective as a lead, what kind of advice or top tips would you give to other leads considering campaigns or pieces of work like this?
Education, I think. Go and educate yourself about what is health inequalities, what it means to reach out and listen to what people are going to tell you. You don't have to do it yourself. There is plenty of people out there to help, the likes of Hayley and Sue and other key stakeholders, and I think by working with them you get a much better result, and that's certainly what we've seen in our screening unit.
And Sue, from your perspective, any top tips for anyone listening that you think actually it'd be really good for you to do this to be able to engage in a project or a campaign like this?
I think I'd echo really what Hayley said, Hayley Snowden, well both, but Hayley Snowden too, in terms of engaging right from the start with the people that you, once you've identified the people that you want to target in the campaign, engage with them. Don't work in isolation, but also work with closely with your partner organisations as well, so that everybody is on message really, that you know, and develop three or four key messages of what you want to achieve. You don't need to overcomplicate it. And then work out how best to reach those people, to go to where they are. So whether that is on Facebook community groups, but forums, community centres, it might be groups for example, with this campaign, people with learning disabilities who may go to a day space, spend some time at a day centre. It's about things like bus shelter advertising, which you know we did use a bit of as well, because people and even to the point of mapping out routes of where people might get a bus from the particular area they live in to the breast screening unit that they're going to. So you bring together all of that detail, and you know a really valuable campaign will take shape.
Perfect. We don't usually do this, and Numan's going to be like, oh no, she's going rogue, she's scaring me already. But Numan, you do a lot of work within the health inequalities space, and lots of work that you've done recently out with communities. What advice would you give to people who are wanting to do research projects or campaigns in this space?
Thanks, Jay. You didn't full name me though, University Challenge style. I think, as I think everyone's alluded to, it's about trust. So you can have an idea, but if you don't actually speak to the community you want to help, sometimes there's almost no point because they won't engage with you. So for example, Black Women Rising is by the Leanne Perry Foundation. It took me 3.5 years to start working with them, but now, they can't get rid of me. But it's just about building the trust, and once you've got the trust, obviously maintaining it and not having like a colonial mindset of going to take all your information and help and knowledge and then not kind of give back. So like you said about the legacy website, that's amazing because it's always going to be there. No one's going to be able to take it away from all the work and stuff you've done. So yeah, thanks, Jo.
I'm sure he'll get me back in other episodes. But thank you all so much for joining us on Rad Chat. It was such an interesting conversation and we could probably go on for a lot longer. So thank you all for giving up your time. A huge thank you to our guests, Hayley Gibson, Hayley Snowden and Sue Ormesher, for talking about how they're tackling health inequalities in their region. Thank you all for listening to Rad Chat with myself, Jo McNamara, and Julka-Anderson. So our next guest to feature will be Sarah Phillips as part of our Living With and Beyond Cancer series, talking about living with a disability and accessible clothing ranges.
Well, you can use this episode as part of our free continual professional development, accredited content, which offers flexible learning that fits your busy schedule. Just check out the show notes for the reflective questions, links to literature and resources, and link to the completed form to receive your accredited certificate.
Stay up to date with the latest radiotherapy and oncology advancements by liking and following us on social media and hitting subscribe wherever you get your podcasts.
Please do join our supportive community designed by professionals who understand the unique challenges of working within radiotherapy and oncology. Follow us across all of our social media channels and make sure to check out our website www.radchat.co.uk. Together, we're actively working to improve our profession and make a lasting positive impact on cancer care.
It goes without saying that we can't achieve this alone. It takes all of us working together to create real change. That's why we value every voice and every contribution. We ask that you listen and learn and spread the word, share your story with us and connect with us.
And if you have liked this content, why not buy us a coffee? Go to our website and drop us some love. Thank you all for listening and take care.